It is time for the doctor. I've got Dr. Richard Scott. Hello, Richard.
Hi, Andy. How you doing?
I'm not too bad. I look forward to these with great relish. I just love learning. I don't know lots about medicine, but I like absorbing lots of information about it, if that makes any sense.
Well, it's I have to say it's a challenge for me too, because you stretch me beyond my normal boundaries, which is good. It's good for both of us.
It's good to be challenged, though, isn't it? Because
Yeah,
otherwise, life gets really mundane, and that's no good.
true.
Right. So this week we're going to work through some questions. Let me just double check. 1, 2, 3, 4. I've got 5 questions from listeners for you. We'll take them and we'll see how this goes. Right. First question for Richard. I think this may well be a younger person. Question for Dr. Richard Scott. If you enjoy, for instance, carrots, is it more beneficial than if you don't like eating carrots?
Ah, so not necessarily related to last week. If you enjoy, is it more beneficial? I can't see logically why it should be more beneficial. That said, I'll go beyond carrots in a second. So the actual carrots will do the same job whether you like them or not. But here's the thing: if you do something that you don't like doing because you know it's good for you, that's actually a very good human trait. So sometimes, for example, as Christians, we might think, "Oh, can I be bothered to read the Bible?" And then you go and read it. And actually, in those situations, in my experience, often you get more because God rewards you for your perseverance. So I think the general idea of exercising, I don't always feel like it, which we don't read in the Bible, whatever it is, whatever discipline. If you do something like that in times when the body says no, but you do it anyway. So I think that discipline is good for you. But the carrots, that's, if you like, that's a detail. The carrots will do you the same whether you like it or not.
Right. I was actually asked by Nathan from the Breakfast Show about cold water plunges because he's started having a shower with a cold end. He said, well, how long am I supposed to stand there again? So he started doing it.
Yes.
And he wanted me to feed back to you because what he said was he was clearly quite nervous at the prospect of lovely warm water, cold water. I said, look, 2 minutes, about 12 minutes a week is all you need.
Yeah, 1 to 2 minutes.
So he did that. And he said, I often feel better after a shower because it helps my muscles. But he said, and he's verifying what you stated, he felt much better, quicker, for longer from his muscles from exercise, having had a hot shower with some cold at the end.
Well, good. Thank you, Nathan. Yeah, it's always good to have individual stories backing up the theory. So that's good. Well done, and keep it going.
Yep. And then we had another one I needed to feedback for you, which is somebody who really, really wants to do this. They enjoy running. They walk their dogs. And they said, would it be okay if they waited until the summer when it was warmer before they start doing cold water showers?
Well, I think that's a point that you made, Andy, a week or two ago.
Yeah.
So, yes, indeed. Yeah, as long as these things don't get put off indefinitely. I mean, I think good intentions, by and large, it's good to do with good intention straight away. Otherwise, they can get forsaken. But if you say to yourself, right, as soon as it's, I don't know, June the 1st or July the 1st, then I'm going to do it, then fine. But hold yourself accountable.
Okay, right. I got questions going back quite a while. Question for Dr. Richard Scott. There has been a real push in my organisation that I work for to raise awareness of the menopause, provide support. I'm all for informing people, perhaps to bring reassurance, allay fears, help people cope. But I am concerned about some of the ways this issue is being handled. There is a negative attitude. Some people are responding loudly. Personally, I prefer a quieter, gentler response. It's a personal, private thing. Having said that, I would like a Christian perspective on this subject. It seems to me to be a natural part of life that I know some women will suffer from. But could you please shed some light on the subject of menopause from a female over 50, but only just?
Well, I could answer it from my wife's point of view. So my wife is the same age as me, 63, obviously a woman, therefore she's gone through the menopause. She's an evangelist for HRT. And the reason hormone replacement therapy, and the reason is that whilst it is a natural point of life for women, there's no doubt that when hormones drop off as the ovary stops secreting estrogen to the same extent, there are some awful physiological body symptoms in many people. And once you start getting hot sweats, the change in mentality. So people become depressed, sometimes apathetic. You can have dryness down below. So many symptoms. Lack of energy, loss of libido, the whole works. It's so drastic, where such that people have thought, oh, could this be full-blown depression? Well, actually, no, it's the menopause. Treated very easily with HRT. Could it be other things? Well, no. First of all, think of the menopause. So I would say, based on what she's a real expert with women's medicine, and particularly hormonal aspects of women's medicine. So I'm going to give you her answer, which is that whilst it is a natural part of life, my goodness, this is something that we could help people with. And there are people who seem to sail through without any trouble. That's great, obviously, but so many people do have problems, and then they're so grateful when they get treated and wonder why they waited so long. So I would just say, don't go looking for problems, but if they find you, go and talk to your GP, and most enlightened GPs will put people on HRT as long as there aren't contraindications, notably breast cancer or very strong breast cancer in the family. For most people, it's to be honest, a bit of a no-brainer. It's so worth giving it a go. Because otherwise you might say, well, what else should I not treat that we can help? Asthma, eczema, cancer. No, you might say, well, these are diseases. Well, I would argue that the symptoms related to the menopause are also a form of disease, a dis-ease in the body, which is a disease, isn't it? And so, yeah, I think if you've got symptoms, go and see your GP and get treated.
I like that dis-ease. That's a really good way of looking at it.
It is. And you might say, well, it's there are other things that get worse as we get older. Well, there are, but some of them are highly amenable to treatment. High blood pressure, for example. We wouldn't say that was a dumb thing to treat. Well, I think with the menopause, it's the symptoms can be so rough, really rough, and once we get it right, it's just life transforming.
Is it as simple as, I know nothing about HRT apart from, I know it's hormones, I know it's a replacement, I know it's a therapy. But is it injections? Is it a tablet? What are the different types of it?
So no, it's the same disease, but the treatments differ. And oral treatments, so tablets is a mainstay, but actually these days gels that you rub onto the skin. My wife uses a gel, for example. Other people have a transdermal patch you can apply. So there's different ways, and if someone isn't suited by a patch, they have a reaction. They might have to have oral tablets, whatever. But there are different ways of treating it. But it's not an injection. It's other methods.
Okie doke. Right, another question. How much exercise do we need to complete on a regular basis in order to maintain a healthy lifestyle?
Well, I can tell you what's recommended, which is approximately 30 to 40 minutes, 3 to 4 times a week. So effectively alternate days, but certainly every third day if you can't manage alternate days. And I have to say, I try to do that when I'm not injured. I try to do that as well. So a reasonable puffing and blowing. So not just a walk, unless it's a really fast walk, because we're too efficient at walking. So it needs to be something where you're properly puffing and blowing. Biking, exercise bike, or proper cycling, running, swimming, whatever. But 30 to 40 minutes of really puffing and blowing, raising your heart rate to a decent degree, 160, 170 beats a minute, 3 to 4 times a week. And that's what's recommended for a really good cardiac workout, and generally helps us live longer.
Does it matter if you break up the 30 minutes, or does it need to be a block of 30 minutes?
So when you say, you mean stop at 30 minutes and then go on a bit longer? Can
you do 2 lots of 15 minutes? Is that as good as 30?
I would have thought so. Yes, it's the total amount that you need to do. So that would be fine. I wouldn't have a problem with that. Absolutely.
Cool. Okay. Saw an article on the benefits of fasting for 24 hours in order to help prevent some diseases. I'm wondering what Dr. Richard Scott's thoughts are on that.
Well, I reckon we should do that as a topic. So could I, I've got some thoughts already, but I would like to do it better. So you've just given me another idea, which I'm grateful. We've got a suggestion for next week, which is another hot topic, but fasting actually has been quite a topic. And I might say, my wife, to go back to Heather, gives me a hard time because I don't fast. I have done a little in the past, but there are a lot of benefits, both spiritually and physically. So why don't I suggest we delay this one and do it another time.
Okay, I've got one more question for you. All right, migraines and dark chocolate. What other foods can trigger it? And is there any way of getting around it?
Well, plenty of foods can trigger it. Some people find shellfish, others strawberries, chocolate, cheese. Whole range of foods can trigger it. It's a bit like saying, "Oh, what foods give you allergies?" Well, quite frankly, any food. What drugs give you allergies? Well, even paracetamol, aspirin. Some people are allergic to. So really, it can be triggered by many things. Yes, there are certain common things: chocolate, dark chocolate being one, cheese being another. But and I think people with migraine need to work out what it is. Write down when they have an attack, or what have I had recently, and then a pattern emerges. What can be done? Well, plenty can be done. There's all sorts of migraine medicines. There's both prevention, prophylaxis, to use a flash word, and treatment. So again, this is something that GPs should be pretty well aware of. So yes, absolutely avoid trigger factors. And by the way, there are other common trigger factors. Stress is a common trigger factor. Getting dry, not drinking enough at work. Getting dry, common trigger factor for migraine. So yeah, there's trigger factors: food, stress, etc. Getting dry, a few others. But there's plenty of treatments, and there's some prevention as well. So again, no need to suffer. Get help.
How would you describe a migraine? Because to me, I know nothing, so I just think, well, it's like a really, really bad headache. But that's probably a terrible explanation.
Yeah, well, you're quite right. So often there's some people get an aura; they get a sense that something is about to happen. By no means all. Most people come in and say, "Oh, I've got this headache," and describe that pain, particularly around the eye. Sometimes with zigzags in the vision, blurring and zigzags affecting your vision. So actually seeing zigzag lines is a common cause. Usually people feel a bit sick, but the real classic thing is photophobia. So you get this awful, when you look at a bright light, it just makes your eyesight, it just hurts in the eyes. So classically, people have to go lie down in a dark room without sound. So they can be sound phobic as well. So there we are. It's a sort of picture of light hurting you. It's loud sounds hurting you. Much better off in just quietly in a dark room with a thumping headache. And sometimes, if you're really unlucky, you get pains or even weakness down one side of the body. So it's a nasty disease. Often there's family history. But when people come in with a classic history, we can say, "Yeah, this is migraine." You can often work out what the cause is, and get on and treat them. But it's a nasty old business. But for most people, quite well treatable.
I didn't know it was treatable. Well, no, I assumed there was some treatments. I didn't think it was quite as able to be treated. That's quite interesting.
Mm-hmm. Yeah, indeed.
What did I see the other day? Sticking your feet in water. Is it hot water or something? Is that actually going to help?
I missed that. Sticking what in water?
I'm sticking your feet in water. I think.
Oh, right.
If you've got a migraine, someone says, "Oh, it's like a miracle cure."
Don't know that one.
No.
I'll see if the computer helps him on that. I haven't heard that one. No, unaware.
No. Okay. I was thinking as well. The NHS in the UK, if not from the UK, the NHS is our health system, which is a part as a family practitioner or a GP. Our NHS is struggling in many ways. How can we help people know when do I go to A&E, it's really urgent, as opposed to I can wait a week or so to go and see my GP, or maybe an out of hours thing? Can we help people have some sort of sensible way of knowing themselves which way do I need to go?
Well, that's an enormous question because it depends on conditions. But I think that's a very important one. In that, I think it should be teaching in schools. I think people need to be taught these are the symptoms to watch out for. These minor coughs and colds you don't need to worry about. I think there's all sorts of things. So I'll give you just a brief example. Child with a sore earache, something we see very, very common in general practice. The message from ENT surgeons is that 90% of minor red ears, so it's slight earache or even quite bad earache, but day one, don't rush into the doctor because 90%, so 9 out of 10, will get better themselves without antibiotics. Therefore, come in if it's persisting on the 4th day, for example. So often we see people, "Oh, my child's got a sore ear day one." We say, well, actually, 90% of these will not need antibiotics. Therefore, let's reduce your child's needing to eat antibiotics for 5 days, plus reduce antibiotic resistance. So that sort of teaching would be really helpful in the community, and preferably starting in schools. And same with coughs and colds, don't come to a doctor. Now, more and more it's becoming more and more important because A, doctors are overstretched, and B, we've got more and more sort of para doctors, para physicians, if you like, say like not least pharmacists, who are seeing people with minor conditions. So I think the public need to be taught where they can go safely with minor conditions to a pharmacist, who then, if they don't like what they see, then they send the people to us. But yeah, there needs to be a huge amount of education, a huge amount because I think one of the biggest issues we haven't tackled in the NHS is the government is always pouring more and more money in and more resources. Actually, we need to reduce demand. We need to tell people, you don't need to come in with this. So don't come in with this because it's not necessary. You're not going to get any special treatment. And by coming in, you're stopping more important people coming in. So I think education is a massive issue that needs to be tackled.
Yeah, and I would agree. Schools are a really good place. Dental, I remember having some dentist teacher type person coming in talking about cleaning your teeth, and I was quite shocked, and it was really interesting. And I've always remembered some of that stuff because they were enigmatic, they were passionate, and that retains in your head because it was interesting.
Mm-hmm, mm-hmm. Sure, absolutely.
And we need that in schools. Yes, I completely agree. Right, that was 1, 2, 3, 4. That's about 5 questions and 2 feedbacks that I've been saving up for you since mid-end of December.
Very good. Very good.
Can you let us know what next week's topic is if you seem excited?
So another hot topic, and this came out of the Times newspaper a couple of weeks ago, and I'll read you the headline. Would you take an Alzheimer's test? I did, and it's unnerving. If you want to know, here's the subtext. If you want to know whether dementia is your fate, this lady has the lowdown on the new blood test. So big one. Obviously, there's an awful lot of treatment work going on in dementia. Donazepam, Aricept is a drug that we've used for years, seems to slow down dementia a bit by, say, 6 months. But this is a big one. Would you want to know? Here's a test that's available, well, not yet, but it's coming. That's going to be available. Would you want to know in advance that in, say, 10, 15, 20 years' time, you're going to get dementia or not? And so I'm going to throw that one open for discussion. It's an ethical question. It's a practical question. And there we are, something that you and I might chew the cud over, Andy, and hopefully your listeners as well. So I'm going to look at what is this blood test? Is it accurate? When's it likely to come in? What are the pros and the cons of knowing that down the line, there's a big problem coming?
I have many thoughts already, so I'm not going to go anywhere.
Save it for next week.
Oh, definitely. No, I've got loads of thoughts about the future, sort of self-fulfilling prophecies and all that stuff. So we'll come on to that when you've explored this for us.
And now we've got another one for after that, fasting.
Fasting, yes.
So there we go. We've got two topics. Both they're always hot topics, these things, because they're in the news, which is why it grabs people's attention.
Yeah, no, absolutely. And you said you thought this might be a quick week. It's not. Thank you, Richard. If you've got any questions that you've seen in the news, any hot topics that you're seeing, then you can email us here and I'll put them to Richard. The email is hello@pure247radio.org. hello@pure247radio.org. Dr. Richard Scott, GP, is a GP or family practitioner if you're from outside the UK, and you can send your questions to him through me. Thank you, Richard.
Andy, always good. And fun as usual.
Absolutely. Thank you kindly. Have a good time. Bye.
Cheers.
Pure 24/7 Radio is listener supported, which means we are free, online and always pure because of the generous support of our listeners. If you would like to contribute financially, please visit pure247radio.org. If you'd like to find out how we use your money, please visit the Our Cost section. Any donation of any size will help keep us on air and broadcasting for free. Thank you.